Right, we're going to move to the ground next. We're going to go ankle cars and work our way up to the hips. You're going to need yoga blocks for this. Just one at first, but have the other nearby. So, we will use the yoga block to constrain or help us constrain the lower leg. So we're going to have a seat, and you can be both legs out, one leg crossed. If you're not comfortable sitting all the way down, you can sit on a yoga block or a pillow to get yourself a little higher off the floor. As long as you're comfortable, we want to be able to set the calf on the back of a yoga block and make sure our heel is clear of the floor. So we're going to be doing a few different ankle car variations from here, and I like this position because we can see and constrain the leg to stop rotation of our thigh, which is a hip movement. So we want to be able to move our foot without the hip following along. We need that independence. So rest your hands lightly on your leg. And I want you to start by just leaving your foot pointing kind of straight up and twist the sole of your foot to point toward the middle of your body or the inside. This is called ankle inversion. We're going to work on this a little bit more later. And then we're going to go sole of the foot to the outside of the body, ankle eversion. I actually got that backwards. Inversion, eversion is correct, but we're going to work on eversion later. So just go for this tipping back and forth. Your goal is to twist the sole of your foot in and out a little bit farther every time. I'm going to give you guys about 30 seconds to work on this. If you notice your toes doing some weird stuff, see if you're going to relax your feet, your toes, and just move at your ankle joint. You got time for one more each way. So this tipping of the foot, twisting the sole in and out, is the quote-unquote rotation of our ankle. And so as we're circling our toes for ankle cars, we want to always be capturing as much of that inversion and eversion as possible. So let's pull the foot back toward our shin. This is called dorsiflexion. And then we're going to start by going toward our big toe side. So I want you to initiate by twisting the sole of the foot to that side. And all this should be pain and pinch free. So if you notice anything, just stay away from those spots. Now that you've twisted over, also try to bring the big toe across as far as you can to that side without turning your kneecap or thigh along with. And then start to point your foot, but we're still trying to twist the sole of the foot to the middle. Once we've achieved the foot pointed as much as we can, we're going to swing the big toe to the outside of the body and also turn the sole of the foot that way. Keep trying to pull that pinky toe back toward you as if you're showing the bottom of your foot to someone over there, and pull back as much as you can. Once we're back as much as we can, we're going to switch directions. We're going to reverse and go right back toward that pinky side, going into ankle eversion, sole of the foot to the outside, pushing down the gas pedal to point our toes and foot again. Twist the sole of the foot to face in, take the big toe over there as well, and drop back. Speaking of joint independence, my toes over on my opposite foot just started cramping for some reason because they're kind of connected. So this whole idea of separating joint motion can even happen on opposite limbs. On that note, I've observed many people moving their mouths during knee cars. See if that happens to you. All right, so we're going to do another round of those ankle cars. Heads up, this one may be very crampy. And you're going to want to be careful about the size of the car or the effort you apply. I'm going to ask you to take your ankle through the same motions, except with your toes curled in a fist. If that hurts, just don't do it. You can do the same old cars we did before, all right? Pain-free is the name of the game. So if you are going to curl your toes, understand that this is the priority. As we move into plantar flexion, or the foot pointed, your toes will want to uncurl. And I would like you to try to reduce the size of the car so that you can keep these toes in a tight fist. Twist to the inside first. And then start pointing your foot, keeping your toes curled. Watch out for cramps. You're only going to go as far as you can keep the toes shut. Oh, that's gnarly. And then we're going to swing it to the outside. Try to point the sole of the foot to the outside. Pulling the pinky toe back to you, you're going to pull the foot toward the shin again. Make sure those toes are shut tight. Once you're back here, reverse directions. Twist to the pinky side. Prioritize, toes curled. Try to gas pedal it forward, keep them shut. Adjust the size so the toes stay shut. Twist the sole of the foot to your inside. And sweep that foot back to you. Oh, gnarly. Okay. Another look at the same qualities. This time, we're just going to work on pointing the foot and pulling the foot back. So relax your toes, point your foot as far as you can, hold the effort. Now pull your toes back towards you. So the foot is pointed, the toes are flexed back. Watch out for cramps. Try to squeeze your toes into a fist. Only go as far as you have control or as far as it is pain-free or cramp-free. And we're just going to practice this a few times. Toes pulling back to you. If you get a real gnarly cramp, shake it out. Oh, there we go. And toes forward. So that we're trying to change the toe position while keeping the ankle in plantar flexion. One more time, toes back. Oh, they're cramping so bad. There we go. And toes curled. Ooh. All right, those are our few drills. Let's switch over to the other ankle. If you're someone who ever notices like bottom of foot cramps during the day, these toe curl variations are very useful to help your nervous system become more acquainted with those ranges. It seems like, exposure therapy, I guess because it is, but the more you kind of flirt with these cramps, the better your brain will have control of those positions. So we're going to start out with some regular old ankle cars. We're going to lightly constrain the leg with at least one hand. We're going to pull the foot back toward us a little bit and start by twisting the sole of the foot and just twisting it. Sole of the foot in, sole of the foot out. Let's do that a couple more times. Twist it in, and we're looking for independence here, right? So keep your toes out of it. Just turn the sole of your foot. One more time. Stay in pain-free ranges if you notice anything weird. Sole in and sole out. All right, now really pull back as much as you can. We'll start our first round of cars. We're going to twist first, sole in, and then try to get the big toe to go that way as well. And then start pushing on the gas pedal to point your foot. Point as much as you can. Twist the sole of the foot to the outside. Slowly draw back. Keep twisting out. Once you get back into dorsiflexion, reverse directions, go back the way you came. Twist the sole of the foot to the outside. Try to get the big toe to go over there as much as you can. Point the foot. Twist to the inside. Draw back to you. All right. Second round of ankle cars, same deal with the toes tightly curled and maintaining a priority for toes curled. Twist the sole of the foot to the inside and begin to cautiously push the gas pedal. Do not allow your toes to uncurl. Adjust the size of the car to accomplish that. Swing the sole of the foot to the outside and pull back. Keep those toes squeezing. Once you get back to you, reverse directions, go back to the outside. Push the gas pedal. Toes stay tightly curled. Adjust the rep so you can keep those toes curled. Invert the foot, sole to the inside. Squeeze the toes and drop back. Those are nasty, right? Oh, okay. We're going to point the foot as far as we can and practice holding our foot in this position as we pull toes back. And then try to curl the toes. The angle here at the ankle shouldn't change, so the degree of foot point is the same as we go for number 2, toes back. And curl toes. Last one, toes back. Fun fact, when your ankle is plantar flexed and your toes are pulled back, this is a very stiff and springy position for the foot and ankle. And it is the way that you should strike the ground if you're like jumping rope or you're doing any bouncing on the balls of your feet. Last one, curling the toes. Oh, and then get out of that cramp zone. Okay, next up we're going to do some knee rotations. We'll do knee cars a little bit later. So we're going to just start rotating from several positions to challenge your control and to compare how knee rotation is different in different degrees of knee bend. So we're going to start on the easy ones. We're going to go foot as close to you as you can. And if you don't have a hip that flexes a lot and you have really a lot of trouble with this position, this becomes a lot easier if you sit on a yoga block or two. It allows your foot to come a little closer to your butt. So, with the foot close to the butt, we have our knee bent a lot. And we have more rotation available to be expressed in these positions of deep knee flexion. So, if you're looking for some help, you're just going to stack a hand on your knee so that your thigh doesn't wobble. Toes are up. Twist the shin outwards as far as you can. And twist the shin inwards as far as you can. We're going to do, a handful of these. So let's go for 30 seconds. And I want you to use your hands on your shin to encourage your brain to give you more. This is not an active passive assist as we did with wrists last week or elbows, but this is just like tactile encouragement. So I'm in my internally rotated shin position and I want a little bit more, so I'm going to use my other hand to just say, hey, turn this way a little bit more. Same goes for the opposite direction. Twist the shin outwards. When you hit your limit, as you're asking for more with your hand, just gently drag across and see if that gives you a little bit more. All right, so what we're going to do now is actually go into active passive assist. So with our foot close to us, we should be able to reach our foot. So as you're rotating out, I want you to reach down, and when you hit your limit, you're going to keep trying at your shin and add a little passive help from your hand. And just say, hey, shin, go a little farther. And you might feel a little stretch in here. That's fine. Now go inwards. When you reach your limit, use your other hand and come across. Feel free to use hands however you want. Grab the ankle, the shin, but we want to create passive help now. So rotate out, find more. When you're stuck, hands help. Get a little bit extra. Rotate in. When you're stuck, hands help out. We get maybe another millimeter or two. Cool. So now we're going to move the leg to a position where the knee is almost straight. Very different. So let's go out, and we want a second yoga block here. And we're going to use the yoga block to support our knee in this position. And if you're pretty confident in your knee control, I want you to use a medium height yoga block. If you need a little bit more wiggle room, use a taller position on the yoga block. So we want that yoga block right at the back of the knee joint so that we can comfortably stay in this position of knee bend without using much effort from our leg. So now, with the toes pulled back slightly, we're going to look for the same rotations. Rotate your shin outwards. Go as far as you can. And then inwards. And we're going to go into that tactile encouragement here. So when you're at your limit for external rotation, use your hands on the shin and just say, hey, go this way a little more. You're not actually helping, you're just providing guidance. And then rotate inwards as far as you can. A little bit of encouragement. Just slide to tell your brain which way to create the effort. Practice this about 30 more seconds. Watch out for any thigh movement. Your thigh is rotating in and out, so you can clean that up and get it out of the movement. Finish up this last one, make sure you do the same number in and out. And then if you can reach your foot, you can go active passive assist here. If you can't really reach your foot, you can more firmly grasp the shin and give yourself that passive help. So start with external rotation, turn the shin outwards. When you hit your limit, provide help with the hands to see if you can go a little farther. Then turn in. When you hit your limit there, help from the hands on that shin. Try to get to come in another millimeter or so. The purpose of this is for you to start to understand the differences between your active end ranges and your passive end ranges. So rotating out, add the help from the hands. Did you get any more? Hopefully you did. Rotate in, add that help from the hands, and then rotate out. Last one, we're going to do 3 of these each way. So we got one more into external shin rotation, and one more into internal shin rotation. And then we'll give this side a break. All right. Let's go to the other side. So you guys know how there's like a meniscus inside your knee, right? That's a cartilage disc that sits between the femur and the tibia. Well, our synovial fluid, which is the lubricant of the joint, it actually exists inside the cartilage, kind of like water in a sponge. So when we rotate our knee, we create this compression and decompression of that meniscus, and we're squeezing some of the synovial fluid out to get it to circulate around the joint space and just make everything a little bit more buttery. So that's why we see, or in this class, we focus so much on joint rotation, because it allows us to compress the cartilage inside the joint space, whether it's knee, hip, shoulder, whatever. So here we're going again on the first spot with the knee flexed as much as you comfortably can, and then twist the shin outwards as far as possible. And my left hip, it's not as happy here, so I'm going to sit on 2 blocks this time, because what I care about is shin rotation. I don't need to actually stay super low to the ground. So you always feel free to adjust your position as long as the intention is the same. So rotating out, we're going right into tactile encouragement, a little bit of, hey, go this way, and then rotate in. Same thing here, tactile encouragement. So you may even notice here, even though you're not providing actual help with your hand, that hopefully that tactile encouragement does give you a little bit more. We're doing 3 of these. So here's number 2 to the inside, and number 2 to the outside. Or number 3 to the outside. See, I can't count. And last one, 3rd to the inside. And we're going to keep going 3 more times, but now we're going to add that passive assist. So you're going to rotate outwards as far as you can until you get stuck. You keep trying to rotate out. You reach down, hands on the foot or the shin. We're going to physically add more force and see if we can get that shin to rotate a little bit farther. And then we're going to rotate in. When we find our active limit, we keep trying at the shin, add help from the hands, twist that a little farther. And in this way, with a little passive assist, in my experience, has been a good way for people to start feeling a knee joint stretch. So look for sensations on the inside of your knee here when the shin is rotated out. And then when your shin rotates in, look for sensations on the outside, lateral portion of the knee. One more time, back and forth. Active first, step in and help with the hands for the passive assist. Internally rotate, active first, passive second. All right. Grab your second yoga block, and we're going to step this leg out and use the same height block you used on the first side. So if you were tall on the first side, use tall, medium, if medium. So the block's at the back of the knee so we can relax the leg. We're going to pull the toes back. This is to help limit ankle motion. And we're going to turn the shin outwards. And then a little tactile encouragement. Say, hey, a little more. And then twist the shin inwards. Tactile encouragement. Number 2, going to the outside. And switch, go back to the inside. Still just a little bit of guidance from the hand. Last one, outside. Remember to look for any movement in your thigh. I see a lot of you guys with a hand on the thigh, that's great. Rotate in for the last here. And then we keep going. We're going to go back into external for our active passives. So we're turning actively till we get stuck. Passively provide help. Internally rotate. Find the active limit. Keep trying. Add passive help. Couple more. Rotate out. Passive help. And so I'm noticing on my left side here that my thigh is following along a lot more than before. So I'm going to keep a hand on my thigh to make sure that as I add this passive help, I'm not dragging my thigh along with me. Last one, out and in. External rotation, grab that shin, twist. Internal rotation, grab that shin, add some twist. Alrighty. We're going to get into some hip stuff out of 90-90. So you can set your yoga blocks aside, although keep them nearby in case you want to adjust anything or have little arm extenders for your 90-90 position. So we're just going to do a few drills here to rotate our hips, and then we'll get into more specific pills rails after that. So let's all set up so that your right leg is forward and your left leg is to the side. That way you are mirroring me. Once in this position, we're going to feel the line of our belt, which represents kind of the line of our pelvis. But we want it to be as horizontal as possible. So the left hip crest here is probably higher than your right. And we're going to try to drop that side of the pelvis, which will be limited by this leg. So eventually you're going to run out of space to go that way. And then you're going to turn your belt buckle to face your knee roughly in the front. And then tip your belt buckle down to get a little bit of a hip stretch on the right. And I think a good position here is to just grab your right ankle so you can have good support. Now let's hold on to a mild stretch on the right hip. We're going to look to our left leg and internally rotate the thigh to pick the foot up as high as we're able. It might not be much at all. And if you can't leave the ground, that's okay, just try. We're going to do this 10 times, holding about 1 second at the top of each rep. So here's number 2, 3, and try not to bend your knee. Bending your knee will make your foot appear higher, but it doesn't actually rotate your hip anymore, right? So my foot's here, if I pull my foot in, oh, it seems a little higher, but that actually didn't do anything at my hip, right? Here's number 5, 6, 7, 8, 9, and 10. Good. Same leg, the left side. We're going to try to stay in this position of pelvis relative to right side. So you do not want your belt line to change. We're going to lift this knee. It's not going to be much. Lift it until you get stuck. Do not let your pelvis move. Drop that down. Lift it, and drop it down. I'm just going to go for 5 of these. Lift it, and drop it down. I think we have 2 more. Can't be sure until I look at the recording later. Oh, I'm getting some head nods. All right, all right. All right, now we're going to lift it 5 more times, but we will let the pelvis shift. So lift until you hit that sticking point. Let your pelvis move. Take that leg as far away as you can without losing this knee on the ground. Now I want you to try to get that stretch on your right hip again as we come down. So I want you to bring this leg down as far as it goes without moving your pelvis. And then keep driving this knee down and shift the pelvis back until this knee is down, and then keep shifting until you feel stretch at your right hip again. Okay? So we're going to try to do this sequence 4 more times. Pelvis is steady, knee lifts. Once you get stuck, shift the pelvis. Go as far as you can with the knee. Hold on to this for a second, freeze your pelvis, and drop the knee. Once your knee doesn't go any lower, shift the pelvis until the knee hits the floor, and then keep shifting pelvis back into your stretch on your right hip. 3 left. Again, knee up, pelvic shift, knee goes up farther, hold, pelvis stays, leg drops down. When you can't go any farther here, shift your pelvis, left knee will hit the floor, pelvis continues to shift until we feel right side stretch. 2 left, knee up, pelvic shift, knee up farther. Hold the pelvis position, drop the knee. When you can't go any farther, shift the pelvis, knee comes down. Keep shifting pelvis into right side stretch. Last one, hold pelvis position, lift the left knee, shift your pelvis, left knee keeps going. Hands can go anywhere you like. Max out the distance between your knees and then freeze your pelvis. Drop your left knee back down. When you can't go any farther, pelvis shifts all the way back to stretch. Okay. Last thing on this side, we're going to do 3 hip cars. They are partial range of motion hip cars, so we don't have room to move the entire leg. But go ahead and make this a little easier on yourself. Just lean off to your right slightly. We want to position, very important, where the torso does not move when we lift the left knee and foot simultaneously. They must lift at the same time. So you can continue to hold your ankle on the front if you want. Lift up that side. Make sure you can do this without moving your torso. If you can't, lean farther. We lift up. We hold. The knee rises as the foot slides forward. The knee does not go forward, just the foot. When you're stuck, you're going to reverse it, send your foot back, and float your leg back down to the floor. Knee and foot arrive at the same time. Boom. We should not be moving pelvis or torso, or at least trying to minimize movement there. 2 more. Lift up, swivel it, knee up, foot forwards, reverse it. Now if you're having an easy time, you can just sit a little bit taller. Last one, leg up, swivel it, reverse it. Nice, and let's switch sides. So we're going to run that same sequence over here. Give me a little wave if you got questions. Remember, if you're ever feeling like you need a little extension of the arm, the yoga block is a fine option for that. So keep those close by in case you want. So first thing is to become aware of our belt line, our pelvis. First we drop the right side of the pelvis down. Then we turn the belt buckle to point somewhere around the left knee. Then we're going to tip the belt buckle down and create a stretch, gentle stretch, on your left hip side. Then grab the ankle somehow here on that left leg, hold position 10 times, internally rotate the right, and lift the foot. And down. Lift. And down. Remember, keep the knee in the same position, just turn the thigh. Lift. Down. Here's number 4. 5, try to go higher every time. 6, 7, 8, 9, last one, 10. Very nice. All right, from here, bring your attention back to your belt line and pelvis. We got to keep that perfectly still 5 times. Lift the knee without moving pelvis. Not much here, just a little bit of lift. Squeeze it and set it down. Again, lift. Squeeze that side hip stuff. And down. Lift. and down. Looking for a little more effort every time, as long as you're feeling safe. Squeeze it a bit harder. This is all about expanding our range of control. So try not to repeat the same 5. Try to ask for more. And down. All right, we're going 5 now with pelvic shift. So frozen pelvis, lift the knee. Shift the pelvis, lift the knee farther. Max out the distance between both knees. Feel free to lean back into your hands here. Now, freeze your pelvis. Drop the right knee back down as low as you can. When it doesn't go any lower, shift the pelvis back until you feel your stretch again on your left hip. So we're turning that belt toward the left knee and tipping it down. Here's number 2. Freeze your pelvis. Lift your knee. Shift your pelvis. Lift your knee more. Max out that distance and freeze the pelvis. Drop the knee back down. Shift the pelvis back into stretch. All the way into that left hip stretch. 3 more. Freeze pelvis, lift knee. Shift open and away. Moving that pelvis. Remember to ask for more even here. Freeze your pelvis. Drop your knee. We can ask for more here too. The lower the knee goes, the more the hip is rotating in. When you can't get any more there, then turn your pelvis. Be specific on these next 2. I want you to try to find your limits at each stage of the movement. Freeze pelvis, lift knee. There's that limit. Shift your pelvis, drive the knees apart. Find this limit. Ask for more. Freeze pelvis. Drop your right knee down. Find this limit. When you can't go any farther, shift that pelvis back. And there's a limit here too. That's the stretch on your left hip. Turn that belt over into that stretch. Good. Last one. Freeze the pelvis. Find this first limit, just the knee. Shift the pelvis. Both knees as far apart as possible. Keep pushing those knees out. Freeze your pelvis. Drop the knee down. Find this limit. And then shift your pelvis back into your stretch. Awesome. Okay. Finally, we're going to do some toe cars before we move along. All right, so let's get back into the position where we were sitting for our knee cars. So if you were using a block or 2, go ahead and grab those and sit on them again. So we're just going to set the foot. If you can sit with both feet, that'd be great. We're going to start there. And if you want to sit on a chair instead, that's totally fine, right? You don't have to be on the ground. We're going to look at both of our feet. And the first thing we're going to try to do is work on toe splay, or getting the toes apart from each other. So go ahead and first observe the tripod of your foot. Big toe knuckle, pinky toe knuckle, and heel. We don't want the weight to change across the tripods. The weight distribution should be the same. Lift all toes up. Without changing the tripod, try to spread your toes apart so that none of them are touching each other. And keep them spread apart as you push them down. Do that again. Toes up, toes out, toes down. Again, toes up, out, and down. All right. Now, depending on where you're at with this next one, you may use your hands if you're having trouble. What we want to do is lift only the big toe by itself, without the little toes coming along for the ride. And if that doesn't compute, then use your fingers and hold down the little toes to practice. See if you can get about 5 of these wherever you're at. Got a couple more. Okay, now it's the opposite. The big toes will stay down. Make sure you don't lose or collapse the arch. You don't change the tripod of the foot. Lift the little toes. And down 5 times. Just the little ones. Up. And down. Big toe and the tripod stay the same. Up. And down. A couple more. Up. And down. Last one. Up. And down. All right, we're going to work on some passive range holds on the big toe. So what we're going to do is we're going to use both of our hands to pull back the big toes as high as we can without pain. And then we want to also pull them towards each other, so away from the other toes. So we're going up and away from the other toes. Now I want you to watch both of your big toes. Irradiate your legs with tension, including your feet. Try to hold your big toes in this spot as you slowly remove your fingers for support. Once your fingers are clear, we're going to hold 5, 4, 3, 2, 1, and then set down. So most shoes are not foot-shaped. Most shoes have a pointed toe at least. So if you're anything like me, my big toes stayed up, but when I let go of my fingers, they went whoop over toward the other toes, right? So wherever you're at, just try to hold the position. And even if your toe's falling down or drifting in, just try to hold it in that top position. We're going to do 3 more. Pull the big toe up, off the ground, and then pull them towards each other away from the small toes. Find the maximum distance in both directions that is pain-free. Irradiate, and try to hold them here as you slowly remove the fingers. 5 seconds. 4, 3, 2, 1, set down. Is one foot better than the other? 2 more. Toes up and in. Irradiate, that means stiffen, flex your feet, and release those toes and hold. 5, 4, 3, 2, 1, set them down. Last one. Pull those big toes up, drag them in, irradiate, remove support, and try to hold. 5, 4, 3, 2, 1, and set down. All right, cool.